Welcome, ladies and gentlemen. My name is Mohammad Usama, and we are talking about the hip joint. And this specific lecture, we're going to talk about the movements of the hip joint, the nerve supply of the hip joint, as well as the blood supply of the hip joint. So, let's start off with the blood supply of the hip joint. Now, blood supply to any joint is very important for its integrity and its health. Otherwise, it can lead to avascular necrosis of the joint. Now, to provide the nutrition or the vascular supply of the hip joint, we have the majorly the medial circumflex femoral and the lateral circumflex femoral arteries. As we can see in this picture, this is the lateral femoral circumflex artery, and this is the medial femoral circumflex artery. They are actually branches of the profunda femoris artery. Here we can see this is the profunda femoris artery, which is giving branches the lateral and the medial circumflex femoral artery. So a small contribution is also from the foveal artery, which is in the ligamentum teres, or the ligament of the head of the femur, which comes and attaches at the fovea. So this branch, which is known as the foveal artery, comes, and through the fovea it supplies the superior aspect of the head, but it is not sufficient to supply the joint on its own. So it needs to be along contributed or helped along with medial circumflex and lateral circumflex, which are responsible for the major supply of the head. So whenever the fracture of the femoral neck occurs and this medial and lateral circumflex blood supply is disrupted, so this can lead to avascular necrosis because of the lack of the foveal artery to supply and keep the head healthy and alive. So that is not sufficient in itself. So there are also anastomosis at the level of the hip joint, which exists between femoral artery and profunda femoris artery, as well as the gluteal vessels. And there are two different types, which one is the cruciate anastomosis and one is the trochanteric anastomosis. Now, this trochanteric anastomosis provides most of the blood to the head of the femur, and this is pretty much all about the blood supply of the hip joint. So the things that we have to remember is specifically the medial and lateral circumflex arteries, which are the most important in the blood supply of the head of the femur, as well as the overall hip joint, and as well as a small contribution by the foveal artery. Now, moving on to the nerve supply of the hip joint. So it is a big joint and it is supplied by three nerves. Majorly it is supplied by the femoral nerve and its femoral branches anteriorly, as well as it's complemented by the obturator nerve in the anterior inferior aspect. It is also supplied by the sciatic nerve, which supplies the posterior aspect of the joint, and that is regarding the nerve supply of the hip joint. Now, regarding the movements of the hip joint, as I already mentioned, that it is a triaxial joint, is the ball and socket joint, and it is one of the most movable joints in the body because it can move in all 3 degrees of freedom, and which means it can move in all the axes as well as all the planes. So talking about the sidal plane, the movements that occur at the sidal plane at the level of the hip joint is the flexion and extension. So we also use the word hyperextension for extension because moving the leg anteriorly is known as flexion, bringing it back to the neutral position is known as extension, and moving it beyond the neutral position is known as hyperextension. So if we take a look at the overall range of motion, it is around 135 degrees, in which if we take the neutral extension as 0 degrees, so there is 120 degrees of anterior movement, which is known as flexion, and 15 degrees of posterior movement, which is known as hyperextension. Now, talking about the movement in the frontal plane, we have 2 movements, which is known as abduction and adduction. So if we are standing in the neutral state and if we move our legs outwards, that is known as abduction, as we can see in this picture. And if we move our leg past the central line, then that is known as adduction. So there is 45 degrees of adduction, abduction range of motion, and adduction is of 25 degrees past the neutral position, which is as we are standing in the anatomical position. Now, another range of motion that is possible at the hip joint is in the transverse plane, which is in the form of medial rotation and lateral rotation, also known as internal rotation and external rotation respectively. So if we move our leg outwards or our feet move outwards when we are in the standing position, then that is lateral rotation. And if we move our leg inwards or our feet moves inwards in the standing position, and that is known as medial rotation or internal rotation as well. So medial and lateral rotation are the two movements that occur in the transverse plane and the hip joint, and it is also sometimes referred to as internal and external rotation respectively, as I already mentioned. And there's an approximately of 45 degrees of rotation possible in each direction from the anatomical neutral position. It's also very important to know that being a 3-degree of freedom joint, in addition to flexion, extension, abduction, adduction, and internal external rotation, a combination movement which is known as circumduction is also possible at hip joint. Now these movements obviously occur because of the muscles that are acting on the hip joint. So if we take a look at the muscles which are acting on the hip joint, so we can divide them into anterior, medial, posterior, and lateral. So anteriorly we have the iliopsoas muscle, which are also the prime flexors of the hip joint. And here we can see this one is the combination is known as the iliopsoas, and this one specifically is the psoas major, and this one is the iliacus, which is originating from the iliac fossa. Moreover, these two joints are actually one joint muscles because they are only acting at the hip joint and causing flexion at the hip joint. But there are some muscles which are also acting at multiple joints and located anteriorly, which is one is the rectus femoris, which is actually a prime mover of the knee joint in extension, but it also acts as a secondary muscle at performing hip flexion, and sartorius as well, which also acts as two joint muscles. If we talk about the medial aspect and the one joint muscles, we have the pectineus and the adductor magnus, adductor longus, and adductor brevis. As the name suggests, these muscles are actually responsible for adduction of the hip joint. The two joint muscle which is located medially is actually the gracilis. If we talk about the muscles located posteriorly at the level of the hip, we have the gluteus maximus, which makes a major part of the contour of the hips, and deep rotators, which are a total of 6 in number, such including obturator internus, obturator externus, etc. And we also have multiple joint muscles which actually also make up the hamstring group of muscles, and they are also located posteriorly, and they are actually knee flexors and primary movers in knee flexion, but they are also secondary movers in hip extension as well. And these hamstring muscles include semimembranosus, semitendinosus, and biceps femoris, which are not shown here, but this here is the gluteus maximus. Now, beneath gluteus maximus and slightly laterally at the hip joint, there are two more one joint muscles, which is the gluteus medius, which is beneath the gluteus maximus, and gluteus minimus, and these are actually responsible for hip abduction. And here we can again see this is gluteus maximus, and this is gluteus medius, and gluteus minimus is beneath these muscles. So there's another muscle which is present laterally, and it acts as a secondary hip abductor, and that is known as the tensor fascia lata. Now, if we talk about all of these muscles in terms of their action at the hip joint, so we have tensor fascia lata, which has multiple joint muscles, and it performs two functions at the hip joint. It acts as a combination of flexion and abduction. Moreover, sartorius also acts in a combination of flexion, abduction, and lateral rotation, also known as external rotation, and it is tested by its function, which is known as Faber, which is known as flexion, abduction, and external rotation. Now, in flexion, we have the prime mover, which is iliopsoas, and then we have pectineus and rectus femoris as well. In extension, we have the prime mover, which is known as gluteus maximus, and it is supported by secondary movers, which are the hamstring group of muscles, including the semitendinosus, semimembranosus, and biceps femoris long head. In hyperextension, we have gluteus maximus moving the hip joint beyond the 0 degree to the possible 15 degree of range of motion and hyperextension. In abduction, we have the prime movers of gluteus medius and gluteus minimus. In adduction, we have the muscles including the pectineus, adductor magnus, adductor longus, adductor brevis, and gracilis. In medial rotation, we have the major prime mover of gluteus minimus, and in the lateral rotation, we have the major prime mover of the gluteus maximus, which is also a prime mover in hip extension, along with accompanied with the deep rotators as well for assisting it in the lateral rotation or external rotation. So that was all about the movements and the muscle action of the hip joint, as well as the blood supply and nerve supply of the hip joint. I hope you learned something new out of it, and stay tuned to sqadia.com and watch other series of lectures as well for more information. And thank you very much for watching sqadia.com.